share this space with external audience. And to begin with, I will play a 2-minute video, an introduction into MSF activities, followed by a 1-minute clip on BBC climate change, and then slides on my PowerPoint slides on my field missions. And in the end, we will sum up with a prose and poem, and then with Q&As. So we will start with a 2-minute MSF video.
Doctors Without Borders, also known internationally by our French name Médecins Sans Frontières, or MSF, is an independent medical humanitarian organization. Founded in 1971, MSF won the Nobel Peace Prize in 1999. Today we have some 33,000 staff on the ground in roughly 70 countries. We work in communities affected by war, natural disasters, disease outbreaks, chronic neglect, and other crises. We treat people based on medical needs alone, regardless of race, religion, or political affiliation. On any given day, we assist patients who have no other access to healthcare services. Our medical teams can offer critical services such as surgery, maternal care, vaccinations, and mental health counseling. When people are forced from their homes, we focus on treating illnesses and injuries. We work to prevent disease outbreaks in refugee camps and other settlements. We treat malnutrition and the consequences of sexual violence. Our advocacy message is always the same. People at risk should be able to access health care, and medical workers, even in active conflict zones, must be able to provide it. And life-saving medicines and vaccines must be affordable and accessible to the people who need them most. The ongoing support of our donors, together with the profound commitment of our aid workers, will allow MSF to provide independent and impartial assistance to people in crises for a long time to come. We know that the future holds many challenges for people around the world, but we also know what's possible when we go where we're most needed with the materials we need to deliver life-saving medical care.
I can? Yes. I can go ahead. It's not moving. Okay. I will begin with briefly mentioning about the main issues that we face when we have disasters. And this disasters, as we all know, is sudden disruption involving a huge loss of material, economic, and has great impact on the livelihood of the community. And disasters normally that we encounter are natural and man-made. Natural disasters, as we all aware, floods, earthquakes, and in recent times, it is increasing in numbers. Man-made disasters are mostly human instigated, and they cover industrial accidents, nuclear explosions, and deliberate attacks, which is, of course, we can see like in the Middle East, there is conflicts in most part of the countries in the Middle East. And now increasingly climate change also is factoring into the equation. And this is mostly man-made, but exacerbated by natural causes. And we can see in the greatest, one of the greatest natural disasters that humanity faced recently in the last decade was the tsunami in 2004. And ongoing are the typhoons and hurricanes and human instigated being conflicts. In disaster healthcare, we provide healthcare to which it involves all components, primary, secondary, and tertiary. And for it to be effective, we also need to refer, the whole system needs to work in synchrony. And a big component of disaster healthcare is emergency response missions. And increasingly, as I said, climate change disasters now is taking center front, and it's affecting the world's poorest. They did not cause climate change, yet they suffer its impact. But the good news is there is great awareness occurring all over, and we know a leading figure in this is Greta Thunberg, someone, a young mind, and is creating a lot of awareness and inspiring a great movement around the world. And with that awareness and countries now coming together, even the UN Secretary General in the recent World Meteorological Conference addressed this great concern. He said that the world is broken and humanity is waging a war against nature, and it's a war that humans can't win. So we all have to make an effort, and we can be mindful in the way we make micro changes in our daily lives to reduce our carbon footprint. And also, this is now exhibiting the pandemic, which are two sides of the same coin. Here is a slide on the effects of climate change affecting the population in Kiribati. It's a low-lying island, and in another decade, it will be completely submerged underwater. And another area where climate change is having a huge effect is the Sahel region, Ethiopia, Kenya, Somalia, Niger, and food insecurity is of great concern. WFP is the leading UN agency which is addressing food insecurity. And this year it won the Nobel Peace Prize, and it is working very hard to prevent death from starvation. And here you can see the picture of graves behind this little girl, and it's all mostly from disease and inherent malnutrition. To know more, you can click on the link on a report that MSF has come out, Climate Emergency, a Humanitarian Call to Action. It's a comprehensive report, and it describes our activities with the climate change refugees. You can also see how this has triggered an influx of movement in African countries. People are crossing the Mediterranean, risking their lives and limb for a better future in the West. And that's also part of it is because they have lost their livelihoods, and they have set up to find new pastures. So please do click on to read more on this. Now, about humanitarian work, we aid workers sometimes are asked, why do we do this? And you could say, um, it comes under four. Are we mercenaries? Mercenaries, misfits, or Marxist? So um, either one of this um, attitude or feeling that we have lead us to do humanitarian work, but somewhere along the line, we do the evolution of our work. We move from one category to the other. I may have started out being like a missionary, but now maybe we want to spread equality, and MSF and is very much involved in the in advocating IHL, which is International Humanitarian Law, and also we observe, we bear witness, and we speak out, and especially when we are frontline care providers, um, and we uphold Geneva Conventions and protocol. So part of along the way when we are doing our clinical work, we also uphold basic human rights. Now, I'll move on to the slides that from my missions. This is one of my mission in central Afghanistan. It is Bamiyan. You can see this is a picture of the ruins where the Buddhist statue once was. It was blasted during the conflict. Adjacent to it is the local district hospital, where the population living around there, some of the cave dwellings that you see are still inhabited by the locals. In Bamiyan, in Afghanistan, the Ministry of Health in rural areas has a basic healthcare package, and as in a fundamental around the world, it involves primary healthcare, secondary and tertiary healthcare. This is in the pediatric unit, and this is we're doing a training on CPR. This is for the local nurses in that hospital. As when we are on this mission, we are privileged also to see the landscape and also to live, to see how the livelihoods of the people are. And this is a humble looking mosque bordered by the mountains and a potato farm. This is a farming elder who comes to the hospital kitchen, and we give her food. Along during our missions also, when we are driving along, going from clinic to hospitals and all that, we come across interesting and thoughtful scenes. And this is one of those scenes where I saw a resting place for the deceased. And this is in Kabul. I spotted this 7-year-old entrepreneur busy, engrossed in his livelihood, putting out his matchboxes, his pens and pencils, eking out a living. This is a mission in Switzerland. I'm sorry, yeah, with MSF Switzerland during a meningitis vaccination campaign. We drove thousands of kilometers with 8 I would say, cars heading out to give this, to conduct this campaign. And we succeeded within 6 weeks to vaccinate 1 million people. And that is amazing achievement. With 32 expats, we headed out, and it is one of the most adventurous missions I've undergone, because we crisscrossed the country, and we went into the interior, the heart of the country, and I got to see how the people lived. And here, while we are in the villages, I see it's very heartwarming scenes. And here you see a 4-year-old boy heading for Friday prayers with a prayer mat under his arm and with no pants on. This is the open air masjid, which is headed by the neem tree. Neem trees, we have it in Malaysia too, and I was amazed to see how it thrives so well in these drought-stricken countries. It it gives huge shade, and every mile or so you'll find huge neem trees, and this is where the people gravitate under to sit and build homes. And as you can see, even a masjid is under a neem tree. And another scene that I came across was this teacher who was teaching his students, and the students were sitting on the earth floor. And I was astounded by the mathematics that he had written on this huge blackboard. And I was so impressed with him. And I immediately took out whatever pens and pencils I had with me and I gave it to him. I'm still trying to figure out what equations these are. This is another scene of a household in Niger, complete with the food store, which you can see is on the stilts. This is prevent from the rodents to getting at their corn. And next to it, you can see them pounding the corn. It's so tranquil, and what eco-friendly lifestyle that these villagers live. This is a mission in Dadaab, also with MSF Switzerland. You can see this is the, you could say, small hospital where we have all the units, maternity, inpatients, pediatric, and this is the ER. You can see this 4-legged ambulance waiting patiently on standby to ferry patients from the camps and back to the hospital. This is in the pediatric ward. Malnourishment is very much endemic in this part of the world. And in the camps, we have this local 7Es serving the population. And I'm always fascinated when I'm walking along in the camps. I'll stop by to see what they're selling, and I'll buy things from them. Another mission in Libya. I am a surgical nurse, so I have naturally gravitated to working in conflict zones with war-wounded surgical patients. So in Libya, I was working in the working to take care of the pre and post-operative care of inmates at the prisons. We trained and worked with nurse volunteers, and we took care of patients with surgical and orthopedic surgeries, laparotomies with colostomy, chest tube, internal and external fixators. This is the clinic in the prison, and that's me with the patient and a fellow colleague from Norway and with a local translator. This is a patient with an amputated knee, and we're doing the dressing. Sharing a light moment in improvising places where we can treat patients. This is actually a school classroom, which we turned into a surgical and orthopedic ward. When there's lack of beds, we utilize the floor as well. And this is a field hospital, which we work sometimes, we network with other sections. I was with MSF Belgium, and we network with MSF France. During these missions, our coordinator makes sure that we get enough rest, and we take a R&R. And during one of the R&R, I went to this place in Libya called Homs, where it's the Roman ruins. For me, at the first sight of it, at the entrance itself, I was astounded by the beauty of the archway. I took out my pencil and I started to sketch, which is a hobby of mine. And I was reflecting on these ruins. We see imprint of what once was here, and its echoes resonates through time. If only the finest of humanity's wisdom could prevail. 2000 earlier, the Romans were passing through, and 2000 years later, there's still conflict. The local Libyans are amazing to see their resilience without being told they were cleaning up the streets. Unfortunately, Libya is still at strife till today. This is a mission in northwest Pakistan, also called Khyber Pakhtunkhwa. And I was working in the post-operative unit. I'm sharing the acute care CDs by our none other than Prof. Y.K. Chan, who shared her knowledge with me, and I in turn have taken it and I have shared it with care providers around the world. These two gentlemen are nurses. Yes, nurses come in many different forms, and they are busily engrossed in taking notes on her lectures. This is a post-op patient with chest tubes, and that is a nurse. That's not a relative, but that is a nurse as well, assisting me in sitting up the patient. And this is the patient recovering very well. This mission is in South Sudan with MSF Switzerland. I was in charge of the whole health center, or you can say also a hospital. This is what is called the Continuous Monitoring Unit, CMU, equivalent of the nearest equivalent to an ICU. You can see this is how as bare minimum as it gets to the equipment that we have in order to monitor the very ill patients. And these are patients who are suffering from malaria. And we use oxygen concentrators, and even that we have to share that with so many patients. And these are the local nurses inserting the IV line. Malaria is very much endemic in this region. I'm doing the rounds with the Kenyan surgical resident in the pediatric unit. During our missions, we are given allowances, and when I have leftover allowances after paying for our food, I will buy clothes and gifts for the patient. This is me with, I bought a new dress for this little girl who is suffering from malnourishment, trying to cheer her up, but it didn't work. And nurses sometimes have to multitask. This is a mission in Yemen. I had to help out in the pharmacy. And this is what I really like doing, and that's being bedside nursing. I watched this patient, inserted the NG tube, and this is the grandmother saying thank you. I returned to Yemen in 2015 and boarding a plane in Djibouti. Here in this mission, I worked in the north of Yemen. MSF was strengthening the local hospital, and this is in the post-op unit. This is a patient with upper limb amputation. And here's a shrapnel being removed from missile airstrike. Sada in the north of Yemen borders with Saudi Arabia. Post-op inspection. When we have mass casualties from the aerial bombardments, we have huge number of war-wounded surgical patients, and often the local doctors and expatriates as well, we are stretched very thin, and we work around the clock to treat all these incoming patients. Alongside in working, we also training the local nurses. MSF aim is always to empower and build capacity of the local staff so that once we exit from the mission, the local staff will be able to carry on with the missions. This is the Sada town, desolate, quiet. from the previous night aerial bombardment. And this moving 7 is a van which is often parked at the entrance of the hospital. I often go and sit with them for my breaks. This mission is in Western Tanzania and Duta refugee camp, again with MSF Switzerland. This camp was hosting 30,000 Burundian refugees. Working in the refugee camp, we undertake screenings of all the incoming refugees. And when patient needs um, further treatment, like surgical interventions or medical, we will then refer them out to the local hospitals. This one, we will refer to the Kibondo Hospital, which is about 15 miles from the camp. This is a little girl with a penguin and a missing eye and son that escaped from Burundi. And these are three little camp residents fetching water. And I can't imagine how well they balance on their head. That's, I would say, 5 liters or more. And this slide, it's focused on sometimes the needs in our own backyard as well. I was waiting for the bus in a bus stop, and I came across this man who was lying on the street, and I saw that there were so many people who were passing him by, and no one stopped. So I went near him, and I saw that he was breathing. And then later I called for an ambulance. The HKL ambulance came, and they took him to the hospital. To me, I felt that if those passers-by who, if all of us could stop and do a bit more, it would go a long way. Finally, I would like to say that, working as an aid worker, whether it's in developmental or in conflict zones or during emergency response missions, we face these points: security. But the best form of security is still good relations with both parties that we work. And MSF fundamental principle of neutrality ensures that we are able to do this because we work on all sides of the conflict. We work just to save the people and give them the care. We also get burnt out, and because it's sometimes when we work in disaster areas, man-made or human, it is under intense pressure. And but MSF coordinators often observe, and we have avenues where we can ask for help, and sometimes we can even choose to leave a mission with no issues at all. And sometimes we get psychological support, and we can take breaks, and we can come back. So it is a very open and a flexible way of working. Teamwork also can be a challenge because we come from different cultural background. But for me, I found that we celebrate our differences in terms of, our culture, our cuisine, and sometimes from these missions, we build lasting, lifelong friendships. Rough living conditions come with the territory, but we get used to it. And now I would like to follow up with prose that I wrote about my mission in Syria, and also a poem that I wrote in my mission in Iraq. And I would appreciate very much if Prof. Lam would do the honors of reading this article on Syria.
So I've got the privilege of doing this to give Mathina a brief break from her talk. A short story on Syria, Jebel El Akrad, Syria. There is this mountain, Jebel Akrad, which also means Bald Mountain, in northern Syria, that stands overlooking the valley region below. Each day I would look at it. My eyes would scan the scenery in front of me when going up the hill to the hospital or coming down. I wondered at the White Hill Rocks, of what geological bedrock they were. I once saw a stunning sunset with deep yellow-orange hues. I saw too the biggest half crescent of a moon laying gently amidst the silhouette of hills. I would see hunched back old ladies carrying their load of firewood on their backs, walking along the road. I saw families tending to their orchards of pomegranate, lemons, apples, and olive trees. Screams of laughter from the children playing their games. Noisy sound of motorbikes and cars speeded by on the one main street of Obin. Then you hear the sudden roar of a plane above. You begin to hear the screams of fear and people running for cover. A MiG has flown by and dropped the bombs on the targeted sites. We in the MSF hospital brace ourselves to receive the casualties. Within minutes, the mass casualties arrive. We triage, we clear the airway, we stop the bleeding, we insert the IV lines, chest tubes, we transfuse blood, we wheel patients to OT. We refer our patients by ambulances needing specialized surgery and intensive care. The clock keeps ticking as we race against time, working furiously for precious minutes. Minutes we know could make a difference for a life or limb to be saved. If the hypovolemic shock can be reversed, peering hard into the pupils of the head injury patient, wishing it would be equal and reactive, only to certify them to be fixed and dilated. Those that we could treat, we offer the best of our ER ingenuity and inpatient care. The surgeon, anesthetist, and nurses earnestly do their rounds. We inspect the surgical wound sites, change the dressings, administer antibiotics and analgesia. I would gather my IPD national staff nurses and do my clinical nursing rounds. I would motivate and lead them. Ensured basic nursing care was carried out. I divided my inpatient tasks with the outpatient clinic. One task in the outpatient clinic was to start a vaccination campaign. I brainstormed with the national staff doctor and nurses and came up with a plan. Within a week, we drew up a vaccination register using the Syrian vaccination schedule. We hired daily workers, carried out trainings, and anticipated logistics needs. Liaised with pharmacy and ensured enough supply of vaccines and material supply. Finally, the announcements were made that vaccinations were given in the MSF OPD in Obin village. Nervous at first, not knowing if there would be a large turnout, more than we can cope. As there had been no vaccinations given for a year, moment of truth arrived. On the day of the start of the campaign, hundreds of people did indeed turn up. The trained daily workers and nurses were able to cope. People came from nearby and faraway villages. I took delight in seeing so many cute little babies who would grow up strong and healthy. MiGs kept bombarding villages. We hear the routine nightly shelling. When it gets close, we run down to the basement. Early next morning, off to work. My end of mission drew close. In the last final hour of my departure, a MiG flew past and dropped its bombs. I heard the roar, I heard the screams, and I saw the injured. I had to leave. The team behind will continue. I said goodbye to the staff. I got in the car to get to the Turkish border. I was silent during the drive. I was looking at the orchards and gazed at Jebel Akrad till I could not see it anymore. I was leaving behind a world that few can fathom what it feels like to live where there is no safe haven. What did I take away from this mission? The words of my patient Halabi. He said, when he was young, his mother said there are no angels on earth. When he saw me, he asked himself what I was doing there. I was only there because MSF gave me a chance.
Thank you, Prof. And here I will recite a poem that I wrote during my mission in Iraq. This was a mission with International Medical Corps before I joined MSF. I was working in the emergency unit for 6 months. It was in 2003. right when the second Gulf War took place. And this was what I went through when I was working in Nasiriyah General Hospital. It happened near Ur. From blood to blood, a life soon will end. I know for certain more blood will spill in the ER. How do I stop this madness? Who do I hold accountable, dear God? An innocent 2-year-old beauty born without fingers. Her smile captures my heart. Her fingerless hand pierces my soul. What chemical in the earth, wind, or water that took her fingers? Shattered brains fall at my feet. Where does its dreams go? Bodies and limbs blasted by mines twitch and writhe. A young mother shot through the chest and womb with the unborn bleeds away. The dangling umbilical cord pulsates no more. As the chain stokes set in, biting back my tears, I whispered the last rites in her ears. Lives not lived, the dead are in peace, the living in torture. The walking wounded fill the streets. A bomb blast steals the show, opening up yet another gaping hole. From blood to blood, who do I hold accountable, dear God? I would like to dedicate this presentation to my parents. I, I often look at this picture. Excuse me. And I wonder sometimes what they would have envisioned. But I think I ventured out far more than the little town of Prai where I was born. So I hope I, I honor them with my humanitarian work. Thank you. And if there are any questions, please, we welcome them. Thank you.
Thank you so much, Sister Mathina, for your sharing. I think sometimes we have very technical talks, and today is certainly a very heartfelt talk. And for me, certainly, I find it really humbling and inspiring at the same time to see your passion and the care that you really put into the work and the love that you show to the patients and all the people whom you look after. If there are any questions from the audience, please feel free to post them into the chat group. I'm just going to go through the questions right now, if that's all right with you.
Yes.
Yeah, okay. So the first question is from Prof. YK Chan. She asks, what does MSF feel about death threats in certain countries with respect to the vaccination program? And how does it protect humanitarian workers carrying out its vaccination program?
Okay, thank you, Prof. YK. Thank you for being online. The death threats that humanitarian workers face, in the past, it has been regarding polio vaccine in Pakistan and in Niger. And the tendency is perhaps sometimes involving also with religious people and the indoctrination of the local, the villagers in terms of suspicion of the West, because it was always seen that it's the West who's bringing in this medication. So, and the political innuendos that are involved in it, and it's the concept, the misconcept that the local people in turn uh, they have. So that ignorance leads to them resisting aid workers from coming to the villages to vaccinate the children. But it is a real challenge. We still have to go on with our PR and with our advocacy together with the local health staff and to make them, to give them a clear, comprehensive picture with evidence and the support of the local health ministries to win their trust and in giving these vaccinations. And the Bill Gates Foundation is another one that very much spearheads this vaccination program. And they also have had workers who have been killed, but it's an ongoing challenge. And needless to say that we are winning that challenge, and because the evidence is very clear.
Are there particular protections that MSF offer or provide to their workers carrying out such programs?
It's not only in those programs. As I mentioned in my slides before, security is the first priority that MSF, along with any aid organization, the security of their health staff is the number one priority. And before we undertake any mission, the operational section will go ahead and they will assess the needs, the security aspect of the area that we are going to work. They network with the local authorities and they pave the way. Once it is established that it is secure for the technical team to come in, only then we go in. And even then, as you know, in the conflict countries where I've worked, it is ongoing. But the aid agents and MSF, we give our GPS coordinates prior ahead of time. So the warring factions are very much aware. And the parties of the armed conflict have to observe Geneva Conventions and protocol wherever we work, in healthcare centers, hospitals. All these places are protected by Geneva Conventions. So this is we can say we feel secure in the whenever we work, because we know in the headquarters, they are monitoring constantly 24/7. And anytime when they think that the risk far exceeds the benefits, they will pull us out. Thank you.
Thank you very much for that. And just on the topic of vaccinations, there's just one question asking what kinds of vaccines are given in the settings that you've worked in?
In the primary healthcare centers is the usual vaccination schedule that we follow, that any country has, even in Malaysia. And during, we can say, in certain cases like, we have Ebola and all that, vaccine, there are instances where new vaccine programs undertake, like sometimes, like let's say the meningitis vaccination, which is above, beyond the normal vaccination schedule that is present in all our primary centers. So accordingly, where the needs are, we will do our emergency response campaign. And now, even with the COVID vaccine program, MSF is very much involved, and all over the world, MSF is supporting the local health institutions in Europe and in Africa, because these health systems are very stressed. So in addition to their ongoing already dire situation, and on top of it with COVID pandemic, MSF has stepped in to support the health systems. So it is routine vaccination programs, and in addition to disease outbreak where we have vaccinations available, we will conduct those emergency response mission.
Thank you. There's another question you can see on the screen at the moment. It's by Dr. Chong Li Ai. She says, thanks for sharing these heartwarming stories of how MSF helps each and every of these villages. Does MSF help for longer term benefit in the areas that you go to? It sounds like she's phrasing it along the lines of, is there continuity after, let's say, your visit? And do you know how long these are normally sustained for?
Thank you. Yes, we do. We do. When we undertake projects, especially in developmental context, like we have projects, HIV projects, and, so-called poor man's disease, tuberculosis, Kalaza, and when in malnourishment, when we work in Africa, these are very much, almost you can say endemic diseases. So the projects go on for years, and we do have exit strategy where we collaborate with the local health care actors, and sometimes with other humanitarian actors as well. And sometimes if we want to exit a project, we will hand over to other actors, local actors, but we ensure that we meet our objectives. So we do long-term projects as well. And in some countries like in Niger, for instance, where there's malnourishment for decades, MSF has been there for decades. So there is long-term projects as well.
Right, thank you. The next question is from staff nurse Yani, and I think what she asks is what many people listening are probably thinking. She's from one of the OT's operating theatres. She says, "I love being in humanitarian work. My question is, as a government staff of a Badan Berkanun, can we go for STAT missions, and how the procedure to apply for leave is, what's the correct way?" It may be a little bit hard for you to answer this, I imagine, because you've left the government service for a while, but have you any insights? Because I imagine you must be asked this many times.
First of all, I'm thrilled that a fellow sister in arms is asking me a question. I very much welcome nursing participation in humanitarian work. So thank you for the question. We need OT nurses, like you've seen in the slides. We work in conflict areas, and we're very much in need of OT nurses. And before I answer that question, I also want to say in MSF project, nurses are the ones who hate the projects. In the headquarters, we call them cells. One cell takes care of one region of the operations. And the ones that hate the cells are nurses from, with wide nursing experience. They make good administrators, and underneath them then will come the team of other experts, doctors, surgeons, anesthetists. So I would like to say that in Europe, nursing profession is very much put in the forefront and given the opportunity to excel in all their clinical experiences. So I would take this opportunity to urge more nurses to come on board this humanitarian mission. And it's a very wide, engaging field. It's another world where you will learn. I had to learn as well, even though I had basic surgical experience, but I learned along the way. And to answer your question further, being in the government is indeed a challenge, because we have approached Putrajaya before if doctors can take unpaid leave, but as of now, unfortunately, it is not easy to get. And MSF minimum commitment we need is 1 month, and that is for consultants. If you're anesthetists, surgeons, that is the minimum time we give them. Other than that, we need a commitment of 6 months. So I don't know if government settings will allow their staff to take 6 months or more leave, but I do hope that the government will consider, because when healthcare workers in government settings do undertake these humanitarian missions, especially with organizations of MSF, they will come back with a lifetime of life-changing experience, and to serve the government sector with an understanding of humanity, and to undertake their job with compassion. That we do have that, as nurses, even without having to be nurses. So it is an emphasis on healthcare that we come back with. So I would like to urge um, the policymakers in these institutions to be more flexible with their staff if they do want to take leave to go on these humanitarian missions.
Thank you. So it sounds like there's some work to do still to influence the government to enable our staff to have more opportunities to do such work. There are a few more questions here. Actually, there are quite a lot more questions, and I hope we'll be able to get through all of them before the end of the session. Along the lines of joining missions as well, what is your advice for those highly motivated to join MSF but are worried about family, home, career, and friends left behind? And also along those lines, energizes you for long periods of time in foreign lands far away from normality?
Um, I will take the last question first. What energizes me is simply the joy of being with those patients. I have always liked bedside nursing care and being privileged to, I do not want to patronize these patients, but they are the most vulnerable, most marginalized. They are the poorest of the poor. And being with them, and the beauty and the joy and you see in their eyes, you know, of your presence being next to them. And it is something that I feel so energized. And when I come back to Kuala Lumpur and I stay in my nice apartment and I see this peaceful, a land of plenty, I'm very grateful. But at the same time, I always have this feeling that I'm missing something, and I long to be back on the field. Only by being with those patients, I feel I come alive again. So there is this. This is the reason that it's not just me. Ask any aid worker. It is the worst infectious disease that we aid workers can contract, because we keep going back, and that disease never leaves us. It's very infectious. And the advice I would give to other aid workers to join in is that your passion, your curiosity will lead you. And the other concerns that you have about security, about family and all that, I had my parents who worried about me, but when they saw me coming back safe after each mission, they said they stopped worrying about me completely. Nobody bothers anymore. When I leave on a mission, they don't come and send me to the airport because they know I'll be back in one piece. So don't give too much concern about, security or what you will lose. The benefits you will reap is tenfold. So please go up there. Thank you.
Uh, um, Again, along such lines, there's another question here. If young Malaysians would like to do this compassionate work, how would they go about doing it?
You can start, in your local settings itself, before you want to undertake to join an agency. MSF, the first thing when they ask us, when we apply, is they'll ask us, what made you want to do this, and they want to see how we think and feel in our local settings. Are we committing to helping our community? It starts right here. So when you go out of your homes, where you work, where you are, it's right here. How you, stop to help those, like the patient and the man that I saw on the street. It's that feeling that you have. You can serve your local charities, and then above and beyond, there are hundreds of organizations around the world. And I must say, MSF is one that I hold dear with me, having done 14 missions with them. You can slowly gravitate towards going abroad. So start right where you are, and look around you. Starts with a smile, starts with giving a helping hand. Most of all, starts with, you have to stop, because we are all too busy with the youngsters glued onto their smartphones and all. Just stop, put your phones down and get involved. Start there, and you will go far in life.
Two questions relating to caregivers and care providers. One by Prof. Christopher Boy. He asks, can you please share a bit on how MSF helps the care providers in maintaining morale and overcoming burnout? And there's another one about, may I know any danger needed to face during rescuing the injured? Yeah, so again, it sounds like it's a little bit about security, and another one about coping with morale, maintaining morale and overcoming burnout.
Thank you, Prof. Yes, MSF pays particular psychosocial support team at any time that during the mission, we ourselves can approach our coordinators and we can ask for support. And they will immediately, whether it is on the ground or after we leave the mission, we go for debriefings. And then we can have the access to psychologists. We can debrief with them, particularly when we have undergone traumatic situations, when we have faced, you know, very acute life-threatening moments. And these are situations that takes a long time to recuperate. So I have undergone a few of them myself, but Alhamdulillah, I must say that our faith, our our commitment in what we want to do keeps us going, and we know that ultimately is for the good of the patient. So knowing that our work makes a difference enables us, even though when we are burnt out and all that, knowing that it was for a good cause sustains us through. And when we come back, the support of family and friends and like-minded aid care workers that we are in touch with, we debrief among ourselves. We laugh, we cry, and we get angry, and we go back right where we started again. So help is there, and it fades away after some time, because I have been in so many life-threatening situations that now it doesn't even, I don't even remember them. But at that moment, yes, I've had a gun pointed at my head in Iraq. I've missed a bomb blast by 15 minutes, and I have faced aerial bombardments, not knowing even, it could hit you, So we work in such intense atmosphere, but at the same time, we are doing it collectively. So the strength we derive from the team, and knowing that we are supported by the people in the HQ, and ultimately the patients, we are making a difference in the life of the patients, definitely gets through these burnt out moments. They are transitory in nature, and we are back on our feet in no time.
So I'm sorry we are running a bit over time. I do want to give everyone's question an opportunity to be heard while we've got you, and I hope you can bear with us as well. From Prof. Tengku Ain, what is the biggest challenge you faced in your mission? And secondly, what made you choose MSF over other NGOs like International Red Cross or Mercy Malaysia, for example?
Thank you, Tengku. Um, I started out with International Organization of Migration in Pulau Bidong in 1983. So I started out that because I was so curious to know who were these refugees, what were they doing on that island. That was my early days. So that was the organization I started with. Then after that, when I entered the humanitarian world, I came to know of other actors as well. And International Committee of Red Cross, ICRC, was one I gravitated very much to, because they work in war wounded, in conflict zones. And me being a surgical nurse, I wanted to see which are the organizations that serve in these areas. So it was due to the nature of my clinical experience, and I chose organizations that I can work with to share my experience. So that was ICRC. And then subsequently, I came to MSF. And MSF is an organization where it is, I could say, it focuses all its budget, its resources on using to in the projects, and working as a volunteer was the way forward for me. I felt, money was not the issue that motivated me. Whereas with lots of other NGOs, it can be because of money, and sometimes it can be not also. I have done missions with Mercy as well, but in particular, I maintain being with MSF is because of the huge network that they have around the world. And once I started doing missions with them, it was very easy for them to send me to any of their missions. So because of their global network, I kept on being with them.
Thank you. So there are a few other questions here, and the people asking them are still online, so I'll try and get through them. Sister Umi from Pediatrics, can you tell me about an experience that you've really enjoyed in this humanitarian mission? I think you shared plenty there, but maybe if there's one which stands out especially.
Okay, where would I begin? Okay, I'll tell you this one that I mentioned just now. The one where which I had the gun pointed at my head. It was after a day working in the ER in Nasiriyah in southern Iraq. I normally, we aid workers, we have to get into our car to go home. But I will always tell the driver, you take a break, I'll walk home. But that's not something I'm allowed to do. But sometimes I simply have to walk, after, seeing all those victims in the ER, the bomb blast and 5 deaths sometimes in one shift. It was just so taxing on the mind. So what I would do is from the ER to my home, I would walk I will walk by the Tigris, the Euphrates River. Yes, the famed Euphrates River. So I will take the walk by the Euphrates River back to the house. So one evening when I escaped from the eyes of my driver, I managed to go through the back door and I walked along the river to get back. And unfortunately, during that walk was when uh, a man on the motorcycle stopped and he pulled a gun out, and he pointed at me. And I was, I suppose, from having worked um, from the fatigue that I was already physically, I felt I could not respond. I just looked at him and I told him in Arabic, Anna Mumarida from Mumarida from Malaysia, Sawi Mustashfa Nasiriyah, that I'm a nurse from Malaysia working in Nasiriyah Hospital. I managed to say that in Arabic to him. And he just looked at me with his gun still in his hands and he was thinking, and I was thinking to myself, why is it taking so long? I've got so much reports to do, back in the office. I wish he would get on with it. And then after that, with God's providence, he just put back his gun and he rode away. I didn't look back at him. I just kept on walking at the normal pace, arrived back in the office, because at the end of each day, I have to do the reports. So I was typing out my reports and casually mentioned to my American colleagues, I said, that guy, drew out a gun and he just went on his way. And that guy was stunned. He said, what? I said, yeah, but excuse me, I got my reports to do. And then I just went on with my work. And the next day, of course, I got called by my country director and said, don't do that again. And then that country director, when I was leaving, told me, he said, Mathina, when International Medical Corps Long has left Iraq, the people of Nasiriyah will remember you. So I suppose that is one moment that I will remember.
Sorry, the question was enjoyed, so I was thinking, oh wow, you've
I
enjoyed that
do, I
moment.
do, I do, because it is, it's something that gave me strength, you know, and to come back, uh, to humanitarian world again. I it is a celebration of life and the commitment in work that we do. So that is a an eventful moment in my life, in my career. It's the strength that we have, that we will derive when we do our missions. So, yeah.
So two other questions. One is from Professor Tungku Sara. She asked whether you have any experience with Mercy Malaysia. I think you mentioned earlier
Yes,
that you
I
did.
had.
Yeah.
In 2003, I went to Jordan with Dr. Jeffrey and with another pediatric surgeon. We were based in the Ruweshid camp, yes. And yes, in 2003, we went there.
So the last one here that I can see is from a Dr. Yu Qian Yi. Great humanitarian work you have done, MSF. Unfortunately, it seems after most of the time, it seems that you are all picking up the pieces left over aftermath of greedy and selfish. Oh, sorry, this is a bit political. But anyway, how do you all anchor and convince yourselves to go on? Because it must be quite hard and stressful at times, I imagine.
When I started out, yes, we we have our own personal views and but over time, especially when we work with humanitarian organizations, our fundamental governing principles are medical ethics, as a nurse, as a care provider. So we are governed by medical ethics, right where here in Malaysia too, when we are working in the ER or anywhere. And the same applies when we go out into the world. So I remember when I was in Lebanon working in the Palestinian refugee camp, the same people that I was serving, you know, um, the Amal militiamen came and stormed my clinic. And I felt the next day, I'm not going to work, with this Lebanese militia. How could they do this? You know, and I didn't go in for work for one day. But the next day, I was thinking to myself, no, the one that will be hurt are my patients. I will go back to work. So it is natural for us to feel that, injustice. But over time, especially of having done so many missions, 10 times in Afghanistan and name it, Libya, Afghanistan, Syria, uh, everywhere, we just no longer care much about the politics. We have so much on our hands that we have to hit the ground running, when we are thrown in the conflict situations. We have to set up the ER, we have to sterilize the equipment, we have to get the OT going, we have to work with the logistics on, by the way, which are the unsung heroes. Without them, we don't get to do our work. The logistics who set up the generators, play a huge role in ferrying our vaccines and providing us with the equipment. So the logistic teams are the backbone of humanitarian work. The engineers, the IT people, the financial and humanitarian staff, they are also very much needed. It's not just the medical team. We work holistically with all the rest of the staff. I'm sorry I did not mention them earlier, but they are very much in the forefront. So together, when we set off on a mission, we have so much to do that there is no time to think about, the politics of the situation. But once we come back, we do see that. And the one way that we address that inequalities is by doing things like this. We disseminate and we carry on with our humanitarian work. And by sticking to the hardcore principles of medical ethics and humanitarian values, that's all we need. And which is in itself so much that enough for us to propel us on in our work.
Last question here. It's from a viewer from Miami, Florida, actually, Iftika. He asks, have you gone to mission during the COVID pandemic?
No, that yeah, have not done that. I've been in Malaysia, and I've not, the COVID pandemic has just been a year, so I've not left abroad on a COVID mission, and I've been in Malaysia, and I just do my bit by observing the rules of what we have to practice, social distancing and all that, and I have not. But MSF has and is undertaking projects in COVID, in the prevention of COVID and in COVID projects, be it in Switzerland itself and in all the other countries where we are strengthening this COVID pandemic response.
Well, okay, with that, I think we've gone about 15 minutes over time, and I do apologize as the chairperson that perhaps I haven't done a good job in keeping track of time, but I think it's been truly enlightening and amazing to hear of what Mathina has done in her humanitarian work overseas. I think in a way, moving on as well, there's probably much that we can do and apply here locally as well in our own hospital setting. And maybe we should engage you if you're free at the moment with no missions going on at this current time, because there's just so much team working, camaraderie, there's so much support from a debriefing and helping one another cope, which I think we can learn a lot here as well in terms of our own hospital and how we're practicing. And maybe in the longer term, there's also a need to explore mechanisms to enable our own staff to get involved in humanitarian work. As you say, it's addictive, and you want to keep going back to it.
Touche, touche, Prof. Lam. Absolutely, you summed it up very well. I don't have children, but I have nephew, nieces who are doctors and nurses. I do hope that they will pick up the baton where I left off and far beyond that as well. I like this suggestion of compiling to writing a novel, which is what I've been told to. I do have my writings and sketches, and yes, I will get on with it because I, I feel that, from your enthusiasm, which again energizes me, inshallah, I will seriously work on doing that. Thank you so much again for the organizer for giving me this platform. I'm so thrilled to have so many questions. This, online thing is not bad. I've got more questions than I had from a real life audience in front of me. Thank you.
It's the new norms we are getting used to. So with that, I can only just thank Sister Mathina once again and the organizers of Breakfast at FOM for having us. And thank you all very much for joining us this morning. Have a very good day. And for all celebrating Christmas, have a Merry Christmas and a Happy New Year. And we'll see you we'll see you next week before the New Year. So see you all again. Thanks very much for joining us today.
Thank you.